Your knees hurt with every step. Walking to the mailbox makes them ache for hours afterward. Stairs feel impossible, and your knees feel like they might buckle and drop you to the ground at any moment. Your doctor told you to walk more for exercise, but walking makes your knees worse, not better. You're watching your world shrink as your knees get weaker, and you don't know what to do. Here's what nobody's telling you. Forget walking if you have weak, painful knees. There's one specific chair exercise that physiotherapists and orthopedic specialists prescribe over walking for people with knee problems, because it actually strengthens the muscles that support your knees without any of the damaging impact and stress. I'm talking about seated knee extensions. Sitting in a sturdy chair and straightening your leg out in front of you, that's it. And I'm going to show you exactly why this simple movement is safer and more effective than walking for building knee strength, reducing knee pain, and protecting your damaged knees from getting worse. Let me explain why walking, despite being generally healthy, is often the wrong exercise for weak, painful knees. Every single step you take involves impact forces 2 to 3 times your body weight landing directly on your knee joint. If you weigh 150 pounds, each step hammers your knees with 300 to 450 pounds of force. A typical 30-minute walk involves 3,000 to 4,000 steps, meaning your damaged knees absorb somewhere between 900,000 and 1.8 million pounds of cumulative loading. For arthritic or weak knees, this isn't strengthening. This is destructive. Each impact drives force through cartilage that's already thinning, already damaged, already inflamed. Walking with weak knees is like trying to strengthen a weak bridge by driving heavy trucks over it repeatedly. You're testing the weakness, not fixing it. You're stressing the exact injured area you should be protecting while you're trying to strengthen it. It's like asking someone with a sprained wrist to do push-ups for fitness. When your knees hurt during walking, your body automatically changes how you walk to try to avoid the pain. You shift weight to the outside of your foot, take shorter steps on the painful side, swing your leg differently, stiffen your hip. These compensatory movement patterns might reduce pain temporarily, but they create abnormal stresses on your knee joint that actually accelerate cartilage damage over time. Plus, if your knees feel unstable, walking becomes genuinely dangerous. A knee that buckles unexpectedly on stairs or uneven ground can drop you hard. The fear of buckling makes you walk more cautiously, more tentatively, which means you're not getting the cardiovascular or strength benefits walking is supposed to provide anyway. Here's the cruelest part. The more walking hurts, the less you walk. The less you walk, the weaker the muscles around your knees become. The weaker those muscles get, the more unstable your knees feel. The cycle feeds itself until you're avoiding walking entirely and your world becomes smaller and smaller. Now let me tell you about seated knee extensions and why every physiotherapist I know puts this exercise at the top of the list for knee pain. You sit in a sturdy chair with your back supported and your feet flat on the floor. You straighten one leg out in front of you, lifting your foot until your leg is parallel to the ground or as high as comfortable. You hold that position for 2 to 5 seconds with your quadriceps muscles squeezed tight, then slowly lower your leg back down with control. That's the entire movement. Simple, but incredibly effective for weak knees. Here's why this works when walking doesn't. The quadriceps muscle, the big muscle on the front of your thigh, is the primary stabilizer and protector of your knee joint. When your quadriceps is strong, it acts like a shock absorber. It controls how your kneecap tracks, stabilizes the entire knee structure, and takes stress off your damaged cartilage and ligaments. But when your quadriceps is weak, your knee has no protection, and every step goes straight into the damaged joint. Walking does strengthen your quadriceps slightly, but only while simultaneously hammering your knee joint with massive impact forces. It's like trying to build muscle while also smashing that muscle with a hammer. Seated knee extensions do the opposite. They provide maximum quadriceps strengthening with zero knee joint stress. You're building the muscle armor that protects your knee without ever loading the damaged joint itself. There's no impact, no weight-bearing stress, no risk of buckling or instability. Just pure isolated muscle work that makes your knees stronger and safer. This is why physical therapy protocols for knee osteoarthritis and patellofemoral pain prioritize quadriceps strengthening over walking in the initial treatment phases. The evidence is clear. You get the knee stronger first. Then, when the supporting muscles are strong enough, walking becomes safe and beneficial again. But somehow, the message that reached the general public was just walk more, which is terrible advice for people with severely weak or painful knees. Let me walk you through the science, because understanding why this works will help you commit to doing it consistently. First, isolated quadriceps strengthening without knee joint loading. Research shows that 8 to 12 weeks of quadriceps strengthening exercises significantly reduce knee pain and improve function in people with knee osteoarthritis. The improvement in pain can be 40 to 60%, which is enormous for a non-drug, non-surgical intervention. The reason is simple biomechanics. When your quadriceps muscle contracts strongly, it stabilizes your patella in its groove, takes tension off your knee ligaments, and helps distribute forces across the joint more evenly instead of concentrating stress on damaged spots. But you can only build that strength if you work the muscle without simultaneously destroying the joint it's supposed to protect. Second, controlled range of motion. With walking, your knee moves through whatever range it moves through based on your gait pattern, and you have no control over how much stress hits the painful parts. With seated knee extensions, you control exactly how far you straighten your leg. If full extension hurts, you work in a partial range. You build strength in the range that doesn't aggravate your pain, and gradually that pain-free range expands as your muscles get stronger. Third, zero impact forces. 2 to 3 times body weight per step, thousands of steps per walk, millions of pounds of cumulative stress. Seated knee extensions have zero impact, none. You're sitting, your knee joint is completely unloaded, and the only work happening is muscle contraction, which is exactly what you need. This zero impact quality means you can do this exercise daily, even multiple times daily, without any risk of overloading damaged cartilage or inflamed joint structures. You're giving your knees the strengthening stimulus they desperately need without any of the destructive stress that makes them worse. Fourth, improved knee stability and proprioception. Proprioception is your body's sense of where your joints are in space and how they're moving. When your knees are weak and painful, proprioception degrades and you lose that fine control. That's why weak knees buckle unexpectedly. Strengthening your quadriceps improves the neuromuscular control of your knee. Your brain gets better signals from the muscles around the joint, and your muscles respond faster when your knee starts to move in an unstable direction. Fifth, progressive overload is possible safely. As you get stronger, you can gradually make the exercise harder by adding light ankle weights, using a resistance band around your ankles, slowing down the tempo to increase time under tension, or holding the contracted position longer. All of these progressions continue building strength without ever adding impact or dangerous stress to your knee joint. Now let me give you the exact technique for seated knee extensions, because doing this correctly is critical for both safety and effectiveness. Start by choosing a sturdy chair with back support, a dining room chair, kitchen chair, any chair that doesn't roll and has a solid seat. Position the chair so it won't slide backward when you push against the back. Sit all the way back in the chair so your spine is supported against the backrest. Your feet should rest flat on the floor with your knees bent at about 90 degrees. If your feet don't quite reach the floor, put a book or small stool under them. Place your hands on the seat beside your hips or on the armrests if your chair has them. Now focus on one leg. Let's say you're starting with the right leg. Flex your right foot, pulling your toes back toward your shin. This foot position is important because it helps activate your quadriceps muscle more fully. Keeping your thigh on the chair seat, slowly begin to straighten your right knee, lifting your foot off the ground. Straighten your leg as much as you comfortably can. For some people with severe knee pain, that might be only halfway straightened. For others, you might be able to straighten your leg until it's parallel to the ground, or even slightly higher. Go as far as you can without causing sharp knee pain. Muscle effort and mild discomfort are fine, but sharp pain in your knee joint is a stop signal. When you reach your comfortable endpoint, hold that position for 2 to 5 seconds. During this hold, consciously squeeze your quadriceps muscle as hard as you can. You should feel the front of your thigh working intensely. That muscle contraction is where the strengthening happens. Then slowly lower your leg back down, taking 3 to 5 seconds to return to the starting position. Never just drop your leg. Breathe naturally throughout. Exhale as you lift your leg, inhale as you lower it. Never hold your breath because that spikes your blood pressure unnecessarily and reduces your control. Complete 5 to 8 repetitions on your right leg, then switch to your left leg and do the same number. That's one set. Start with one set per day. As this becomes easier over 2 to 3 weeks, increase to 10 to 12 repetitions per leg and add a second set. Let me be very specific about modifications for different levels of knee pain and weakness, because this is not one size fits all. If you have severe knee pain, meaning osteoarthritis that hurts constantly, a recent knee injury that's still quite painful, or knees that are very weak and unstable, you need to start extremely gently. Use a chair with armrests so you can hold on for extra stability. Instead of trying to straighten your leg fully, just extend your knee partially. Maybe you only straighten it halfway, maybe only a third of the way. That's completely fine. The goal at this stage is not range of motion, but activating and strengthening your quadriceps muscle in whatever range feels safe. Use a very slow tempo. 5 seconds to lift your leg, hold the partial extension for 2 to 3 seconds, 5 seconds to lower. This slow, controlled movement minimizes any jarring or sudden stress on your painful knee. Do only 5 repetitions per leg maximum to start, once daily. After 5 reps, stop, even if you feel like you could do more. Some people with severe arthritis find that placing a small rolled towel under their knee provides more comfortable support during the exercise. Another useful modification is to focus intensely on the muscle squeeze, rather than how far you straighten your leg. Even if your leg only moves a few inches, if you're squeezing your quadriceps muscle hard during those few inches, you're getting strengthening benefit. After 2 weeks of this gentle approach, try adding 1 or 2 degrees more of knee extension. Progress is measured in tiny increments when you're dealing with severe pain. Within 4 to 6 weeks of consistent daily practice, many people notice their knee pain during the exercise has decreased and they can straighten their leg a bit farther. If you have moderate knee weakness, meaning chronic knee pain that flares with activity, mild to moderate arthritis, occasional feelings of instability but not constant buckling, you can be a bit more aggressive with your exercise. Aim for full knee extension where your leg is completely straightened, but don't hyperextend or lock the joint forcefully. Straighten until your leg is parallel to the ground or just slightly higher. Use a controlled moderate tempo. 3 seconds to lift, 3 seconds to lower. Hold the straightened position for 3 to 5 seconds at the top with a strong quadriceps contraction. Really focus on squeezing that muscle as hard as you can. Do 8 to 10 repetitions per leg. Complete 2 sets with a minute rest between sets, once or twice daily. As you build strength over 3 to 4 weeks, flex your foot more actively during the exercise. Pull your toes back toward your shin as hard as you can while you lift your leg. This increases quadriceps activation even more. When the current level starts to feel easy, usually after 4 to 6 weeks, it's time to add resistance. The simplest way is a light ankle weight. Start with 1 to 2 pounds, strap it around your ankle, and repeat the same movement. The added weight makes your quadriceps work harder without changing the zero-impact safety of the exercise. Gradually, over weeks and months, you can progress to 3 to 5 pound ankle weights or stronger resistance bands. If you have mild knee weakness, or you're doing this for prevention because you've had knee problems in the past and want to keep them strong, you can use the most challenging version of the exercise from the start. Sit in your chair and perform full-range knee extensions with a locked-out hold at the top, where you briefly straighten your leg completely. Use a slower tempo for maximum challenge. 4 to 5 seconds to lift. Hold for 5 full seconds at the top with maximum quadriceps contraction, 4 to 5 seconds to lower. This slow, controlled tempo maximizes the time your muscle is under tension, which drives more strength adaptation. Do 12 to 15 repetitions per leg. Complete 2 to 3 sets, daily or twice daily. At this level, you should be adding resistance fairly quickly. Within 2 to 3 weeks, add ankle weights starting with 2 to 3 pounds and progressing to 5 pounds or more over the following weeks. An advanced variation for people whose knees are stable and relatively pain-free is the single-leg chair stand. Stand up from the chair using primarily one leg, then sit back down in a controlled manner, but only attempt this once seated. Knee extensions are completely pain-free and easy for 15 repetitions with added weight. Now let me talk about how to actually integrate this exercise into your daily life so it becomes automatic, rather than something you have to remember and force yourself to do. Habit formation is everything. The beauty of seated knee extensions is that they take only 2 to 3 minutes per session and can be done while you're doing other seated activities. Pick a trigger, something you already do every day, and attach the exercise to that trigger. For example, every time you sit down to watch television in the evening, before you turn on the TV, you do one set of knee extensions on each leg. The TV is your reward for doing the exercise. Or every morning, while you drink your coffee, you sit in your kitchen chair and do your sets. The coffee is the trigger. Another approach is to break it into mini sessions throughout the day. Do one set first thing in the morning, one set at lunch, one set in the evening. Each session takes 90 seconds. Once this becomes habit, usually after 3 to 4 weeks of consistent daily practice, you'll find yourself doing it automatically without even thinking about it. Let me give you realistic expectations for knee improvement because I don't want you to expect miracles overnight. But I also want you to understand that significant improvement is genuinely possible if you're consistent. Within 1 to 2 weeks of daily practice, many people notice that their quadriceps muscle feels firmer when they touch it. The movement feels more controlled and their knee feels slightly more stable. Within 3 to 4 weeks, people typically report less knee pain with daily activities. Standing up from the toilet doesn't hurt as much. Climbing a few stairs feels easier. Getting in and out of the car is smoother. These functional improvements translate directly into better quality of life. Within 6 to 8 weeks, research shows measurable increases in quadriceps strength. Many people find that walking short distances, maybe 5 to 10 minutes, is now possible without significant pain increase. Whereas before, even a few minutes of walking would cause a pain flare lasting hours. Within 12 weeks, people often experience really significant functional improvement, pain reduction of 40 to 60% compared to baseline. I want to emphasize that these timelines are typical based on research and clinical experience, but everyone is different. Some people see faster improvement, others take longer. But the research is very clear that quadriceps strengthening exercises done consistently over 8 to 12 weeks produce meaningful pain reduction and functional improvement in the majority of people with knee osteoarthritis and other knee problems. Let me address specific modifications for common knee problems because different conditions need slightly different approaches. If you have osteoarthritis, which is wear and tear arthritis, where your knee cartilage has thinned and your joint space has narrowed, seated knee extensions are one of the most effective non-surgical treatments available. Multiple studies confirm this. The key with osteoarthritis is to emphasize gentle range within your comfort zone and consistency over intensity. Don't try to force your knee into full extension if it hurts. Work in the range that feels safe. Ice your knee for 10 to 15 minutes after your exercise session, especially in the first few weeks. The most important thing you can do for arthritic knees is build strong quadriceps muscles that support and protect the damaged joint. If you have patellofemoral pain, which is pain around or behind your kneecap, especially when climbing stairs or sitting with bent knees for long periods, this exercise is ideal for you. Patellofemoral pain often results from weak quadriceps, allowing your kneecap to track incorrectly in its groove. The exercise strengthens your quadriceps, especially the VMO, which is the inner portion of your quadriceps muscle that stabilizes your kneecap. Focus particularly on the last 30 degrees of knee extension, from slightly bent to fully straight, because that range activates the VMO most strongly. Avoid locking your knee joint forcefully at the very top of the movement. You might feel a pulling or aching sensation behind your kneecap during the first week or 2 of exercise. That's normal and typically improves as your quadriceps gets stronger. If you've had a knee replacement or knee surgery, only do this exercise with explicit clearance from your surgeon, which typically comes between 6 and 12 weeks post-operatively depending on the specific procedure. Seated knee extensions are often prescribed as part of post-surgical physical therapy, because they're critical for regaining quadriceps strength that's lost during the recovery period. Start extremely gently following the severe pain modification protocol, even if your pain is actually not that bad. Never force against any surgical precautions your surgeon has given you. If your primary problem is knee instability, where your knee gives out or buckles unexpectedly, this exercise specifically addresses that issue. Knee buckling happens when your quadriceps muscle is too weak to control the knee joint properly. Your weight shifts suddenly, your knee starts to bend, and your quadriceps isn't strong enough to catch it and stabilize it, so the knee buckles. Strengthening your quadriceps through seated knee extensions directly improves knee stability. Many people notice their buckling episodes decrease within 4 to 6 weeks as their quadriceps strength improves. You might go from multiple buckling episodes per week to only occasional ones, and eventually to none at all. Now let me tell you about critical mistakes people make that either hurt their knees worse or prevent improvement. First mistake, hyperextending or locking the knee forcefully at the top of the movement. When you straighten your leg, you should stop it fully straightened or just before, not push past straight into hyperextension. Hyperextension puts strain on the ligaments at the back of your knee and can irritate the joint. Second mistake, swinging your leg or using momentum. This defeats the entire purpose of the exercise. You want controlled muscular work. Swinging your leg up fast uses momentum, not muscle strength, and the sudden acceleration and deceleration can jar your knee joint. Always move slowly and deliberately. 3 to 5 seconds up, hold, 3 to 5 seconds down. Third mistake, holding your breath during the movement. Many people unconsciously hold their breath when they're exerting effort. This raises your blood pressure unnecessarily and reduces your control over the movement. Breathe naturally. Exhale during the lift. Inhale during the lower. Fourth mistake, pushing into sharp pain. There's a difference between muscle effort, which feels like fatigue and burning in your thigh, and joint pain, which feels sharp or stabbing in your knee. Muscle effort is fine and necessary for building strength. Sharp knee pain is a stop signal. Work in a smaller range of motion or use a gentler modification. Fifth mistake, expecting instant results and quitting when you don't get them. Real muscle strength takes time to build, 4 to 8 weeks minimum before you see meaningful functional improvements. Knee problems usually develop over years of gradual weakening. You're not going to fix that in a week. Commit to at least 8 weeks of consistent daily practice before you judge whether this is working. Sixth mistake, continuing to walk long distances if walking aggravates your knees, thinking you must exercise through pain. This is probably the most damaging mistake of all. People have been told for so long that walking is healthy that they force themselves to walk, even when it clearly makes their knees worse. When an activity is making your condition worse, stop doing that activity. Get your knees stronger first with seated knee extensions, which don't cause damage, then gradually return to walking once your knees can handle it. Let me give you a direct comparison between walking and seated knee extensions in terms of knee stress so you really understand the difference. When you walk, every single step involves an impact force of 2 to 3 times your body weight transmitted through your knee joint. For a person weighing 150 pounds, that means each step loads the knee with 300 to 450 pounds of force. A typical 30-minute walk at a moderate pace involves approximately 3,000 to 4,000 steps. Multiply 3,000 steps times 300 pounds minimum per step, and you get 900,000 pounds of cumulative load on your knee joint in a single 30-minute walk. For healthy knees with intact cartilage and strong supporting muscles, this is fine. For arthritic knees with thinning cartilage, damaged meniscus, weak quadriceps, or chronic inflammation, this cumulative loading is destructive. Now consider seated knee extensions. Impact force is 0. You're sitting. Your foot never strikes the ground. Weight-bearing stress is 0. Your body weight is supported by the chair, not by your knee joint. The only load on your knee is the weight of your lower leg itself, maybe 5 to 10 pounds. All the work is pure isolated muscle contraction, because there's 0 destructive stress on the joint. You can do this exercise every single day, multiple times per day if you want, and there's no risk of cumulative damage. The cumulative effect is progressively stronger muscles that protect your damaged knee joint better with every session. Think about it like this. Walking on weak knees is like trying to strengthen a weak bridge by driving heavy trucks over it repeatedly. Seated knee extensions are like reinforcing the bridge supports first, so that eventually the bridge can safely handle traffic again. The research backs this up. Studies comparing aerobic walking programs to quadriceps strengthening programs in people with knee osteoarthritis have found that both reduce pain and improve function, but quadriceps strengthening shows larger effect sizes for pain reduction and produces improvement faster. People who do quadriceps strengthening first, building up their knee-supporting muscle strength before attempting walking programs, have better outcomes and fewer pain flares than people who jump straight into walking programs. Now, I want you to track your progress so you can see the improvement happening and stay motivated through the weeks it takes to build real strength. Before you start this exercise program, document your baseline knee function. Rate your current knee pain level during daily activities on a 0 to 10 scale, where 0 is no pain and 10 is worst pain imaginable. Write down that number. Count how many times per week your knee buckles or feels unstable, even if you don't actually fall. Write that down. Can you climb 1 flight of stairs? If yes, rate the difficulty on a 1 to 5 scale, where 1 is easy and 5 is extremely difficult or barely possible. How far can you walk before knee pain stops you? 50 feet, 2 blocks, 10 minutes? Write down that distance or time. This is your week 0 baseline. Now do your seated knee extensions daily, following whatever modification level matches your current knee pain and weakness. After 4 weeks, retest those same metrics. Rate your knee pain during daily activities, count buckling episodes per week, rate stair climbing difficulty, test how far you can walk. Most people see 20 to 30% pain reduction and slight strength improvement at the 4-week mark. Continue your daily exercise. At week 12, 3 months in, retest again. Research shows that by 12 weeks, people typically see 40 to 60% pain reduction compared to baseline. Increased stability with fewer or 0 buckling episodes. Ability to walk 2 to 3 times farther comfortably than at baseline. Stairs that were barely manageable now feel moderate or even easy. Let me translate what stronger quadriceps actually does for your damaged knees in daily life. Because the real goal isn't abstract strength numbers. The goal is functional independence and quality of life. Here's what you might notice as your quads get stronger. Standing up from the toilet or from low chairs without using your hands to push yourself up. Right now, you probably plant both hands on the seat or grab the armrests and push hard to get your body weight up because your quads are too weak to do the work. As your quads strengthen, they can lift your body weight more easily. Your knees hurt less during that movement because the muscles are absorbing the forces instead of dumping all the stress onto your damaged cartilage. Walking to the mailbox without that stabbing knee pain that used to hit with every step. The pain isn't completely gone. Your cartilage damage hasn't healed, but the stronger muscles surrounding your knee are stabilizing the joint better and distributing forces more evenly. Walking that used to be torture becomes merely uncomfortable and eventually becomes tolerable or even relatively comfortable for short distances. Climbing stairs forward instead of sideways or 1 step at a time like a toddler. Weak knees force you to adapt. You turn sideways leading with your good leg. You step up with 1 foot and bring the other foot to meet it instead of alternating feet. It's slow, frustrating, embarrassing when other people are waiting behind you. As your quadriceps strength improves, your knee stability improves. You can trust your knee to support your body weight as you lift yourself up to the next stair, getting in and out of your car without your knee buckling and catching you off guard. That sudden give where your knee just doesn't hold and you have to grab the door frame to avoid falling. Terrifying. As your quads get stronger, those episodes decrease in frequency and eventually stop. Your knee feels solid. Kneeling down to garden or play with grandkids becoming possible again. I'm not saying you'll be able to kneel on hard concrete for an hour, but controlled lowering toward a kneeling position or getting down on 1 knee, or at minimum being able to squat down part way instead of being completely unable to lower your body at all. These functional movements come back as your knees get stronger. Walking through the grocery store without needing to lean on the cart for knee support. Many people with weak knees use the shopping cart as a walker, leaning heavily on it to keep weight off their painful knees. As your knees strengthen, you can push the cart lightly instead of leaning on it. You have mobility freedom again. And perhaps most important, avoiding or delaying knee replacement surgery. Not everyone can avoid surgery. Some knee damage is so severe that joint replacement becomes necessary. But strong quadriceps muscles can allow you to function well enough despite damaged cartilage that surgery can be delayed for years or potentially avoided altogether. Every year you can delay surgery is a year living with your own joint instead of an artificial one. Building knee-supporting muscle strength is the most effective non-surgical intervention for knee osteoarthritis. Let me give you specific guidance on exercise volume and progression, because understanding how to gradually increase the difficulty ensures you keep building strength over months without hitting a plateau or overloading your knees. Start with 5 to 8 repetitions per leg, one set, once daily. Do this for 2 to 3 weeks. When this level starts to feel easy, increase to 10 to 12 repetitions per leg, 2 sets, once daily. Do this level for another 2 to 3 weeks. When it feels easy again, progress to 12 to 15 repetitions per leg, 2 to 3 sets, once or twice daily depending on your schedule and recovery. At this point, you're doing somewhere between 24 and 90 total repetitions per day. That's real volume, enough stimulus to build substantial strength. The next progression is adding external resistance rather than just more repetitions. Once you can comfortably do 15 repetitions for 3 sets, add light ankle weights. Start with 1 to 2 pounds per ankle. This small amount of added weight makes your quadriceps work significantly harder without changing anything else about the exercise. When that becomes easy after another 2 to 3 weeks, increase to 2 to 3 pound ankle weights. Continue this gradual progression over months. One important point about rest days. With heavy strength training like lifting weights in a gym, you typically need rest days for muscle recovery. With seated knee extensions, because the load is relatively light even with ankle weights and there's zero joint impact, rest days are generally not necessary. You can do this daily without overtraining. However, listen to your body. If your quadriceps muscles feel unusually sore or fatigued, take a day off. An important question is, when does walking become appropriate again? Once you can perform seated knee extensions for 15 repetitions times 3 sets with good control and minimal pain, and your daily activities like stairs and rising from chairs have become significantly easier, that's when gradual return to walking may be appropriate. Start with very short walks, 5 to 10 minutes maximum on flat, smooth surfaces like a sidewalk or indoor track. Don't attempt hills or uneven terrain yet. After the walk, monitor your knees. Do they feel more painful than before the walk? Is there swelling? Does the increased pain last for hours or into the next day? If yes, your knees aren't ready yet. Stick with chair exercises longer until your knees are strong enough to tolerate walking. If no, if the short walk produces no increase in pain or only very mild temporary achiness that resolves quickly, that's a green light. Continue short walks every few days, gradually extending the duration by a minute or 2 each week as tolerated. The key is, walking becomes a general activity that you do after your knees are strong and stable, not something you use to try to get your knees strong, which backfires. Think of it as a pyramid. The base of the pyramid is quadriceps strength built through zero-impact exercises like seated knee extensions. Once that base is solid, you can add low-impact activities like short walks, swimming, or cycling on top. You build the base first. Let me urgently summarize everything because this information can genuinely change your life if you apply it. Seated knee extensions, sitting in a chair and straightening your leg are the single most important exercise for people over 60 with weak, painful knees. This exercise builds quadriceps strength that stabilizes and protects your knee joint without any of the impact and stress that makes walking destructive for damaged knees. Physiotherapists worldwide prescribe this as first-line treatment for knee problems because the research is absolutely clear that it works. 8 to 12 weeks of consistent practice typically produces 40 to 60% pain reduction and dramatic functional improvement. Activities that are impossible now become possible. Knees that feel like they're going to buckle become stable and trustworthy. Pain that dominates your life decreases to manageable levels. The exercise requires only a sturdy chair and 2 to 3 minutes daily. That's it. No equipment, no gym membership, no special skills. Just you, a chair, and the commitment to do the work consistently. I challenge you to start today, right now. Do just 5 repetitions on each leg at whatever range feels comfortable. Don't wait until tomorrow, don't wait until Monday, don't wait until you feel motivated. Start now. Then commit to daily practice for 4 weeks minimum. Put it in your calendar, set a phone reminder, attach it to an existing habit. Do whatever it takes to make this non-negotiable for 1 month. Track your knee pain and function weekly using the metrics I gave you. Write down your baseline today. Write down your progress at week 4. You will see measurable improvement if you're consistent. And once you see that improvement, you'll have the motivation to continue to week 8 and week 12 when the really dramatic changes happen. This isn't about accepting knee problems as permanent. This is about actively fixing the underlying weakness that causes instability and pain. Your cartilage might be damaged, your joint space might be narrowed, you might have arthritis that will never fully go away. But the muscle strength that protects and stabilizes your knee can absolutely be built. And when those muscles are strong, your damaged knee functions better, hurts less, and allows you to live more fully. You have control over this. You can make your weak knees stronger. Every single knee extension you do is literally building the muscle armor that protects your knee joint. Stop letting walking damage your knees further if walking is making them worse. Start strengthening them safely today. And if you found this information valuable, please subscribe to Dr. Serena Serrati Senior Health so you don't miss future videos that give you practical, evidence-based strategies for staying strong, mobile, and independent as you age. Before I finish, I need to emphasize that this is educational content only, not medical advice. I'm giving you information based on physiotherapy research and clinical practice, but I'm not your doctor. If you have recent knee surgery or injury within the past 3 months, severe acute knee swelling, suspected ligament tears or meniscus damage, or knees that lock or catch suggesting a mechanical problem, you need medical evaluation before starting any exercise program. If during the exercise you experience sharp stabbing knee pain that's not just muscle fatigue but actual joint pain, if your knee swelling increases significantly, if your knee feels more unstable rather than less, or if you notice any new popping or grinding with pain, stop the exercise and consult a healthcare provider. These are signals that something needs professional assessment. But for most people over 60 with weak, painful, or arthritic knees, building quadriceps strength through seated knee extensions is evidence-based treatment, not just exercise. It's actively fixing the problem. Your weak knees don't have to stay weak. Every knee extension you do is literally building the muscle armor that protects your knee joint. Your knees will thank you. Your mobility will thank you. Your independence will thank you.